My name is Brian O'Connor, the chair of the Global Health Connector. Here today, I want to talk about the question of one of our main partners, GSMA, who many of you may never heard of or heard of because they do Mobile World Congress in Barcelona. I want to introduce you to the head of GSMA Foundry, Richard Cockell. Richard, welcome. It'd be useful if you could just tell us a little bit about GSMA and particularly the work of the Foundry, the innovation arm. It'd be very interesting to hear that and how it connects with health.
Yeah, certainly, Brian, and great to meet you and looking forward to seeing you in Barcelona. Yeah, the GSMA has been around for 30 years and what it was done, it was created really to bring the industry together. But it's also got a role where we look to explore where the new avenues of where mobile will be going and mobile capabilities and connectivity, I think we should really say that is the right word. So within the GSMA, we're looking at what the evolutions of the business models can look like for connectivity products and services. And within the Foundry, what we're looking to do is really explore innovation, try and speed up the process of bringing new products to market, but most importantly, really understand what the needs are of the users of the technology. Because let's face it, I think it'd be fair to say my industry's got a great history of creating products that nobody wants. So really, with this relationship and getting to know each other a bit better, Brian, what we're looking to try to do is understand the needs of your ecosystem and make sure we're building great products and services for the future.
Thanks very much indeed. And that's why I should tell everyone that why we have signed an agreement with GSMA Foundry to be their health partner globally, because it's clear to us that health itself, the whole aspects of health, every aspect of it needs better connectivity. And not just connectivity in terms of carrying a signal or data, but actually working with the members of GSMA who we can collaborate with on specifics. And Richard might give us one or two examples in a second of where this is happening already. And it's important for us as the health industry to understand that we need partners who are not directly in health, but are supporters and align ourselves with what they are doing. So perhaps, Richard, on that basis, you can maybe give an example of one of the things you're doing. I know is a lot on connected hospitals, a favorite one. Just want to
Yeah.
touch on that for a second, please.
Yeah, certainly. I think, anybody that will come to MWC will get to hopefully meet or at least see some of the activities which Dr. Gao from Singapore is leading on. He's going to have a showcase on the GSMA Pavilion, but he's also going to have a number of keynote speeches and other activities in a lot of the things that we're doing together, Brian. But really, what we're trying to do is showcase where connectivity can support in a hospital. Now, I'm not going to pretend to be a healthcare expert, even though Brian and I we've known each other probably for over 10 years now. But what really excited me when I got to speak to Dr. Gao was about the fact of really understanding how he's taken connectivity, private networks, SIM cards, and everything which makes sense in my world and been able to apply it in a really successful way within his hospital. Things like positioning. We talk about that within a factory, but actually positioning and being able to know where all your equipment is a common use case. So you'll probably hear me and you'll hear our show and MWC talking about technology, but really it's about how do we take that capability and translate it into the problems that your members are waking up every day that they need to try and fix.
That's a great example. I was there in Singapore just a couple of weeks ago with Dr. Gao and recognized the way he has, as you say, taken you into his world and vice versa. And
Yeah.
as a result of that, we're bringing him to Barcelona, but also many other people where we can see around the world need for connectivity, but not in a narrow shape of just carrying a signal or data only, but to bring innovation together. So I think maybe you could just tell me before we close, Richard, in terms of the scale of GSMA and the number of the types of number and type of members you have. Just want to touch on that for a few seconds before we finish.
Yeah, so GSMA is a global trade association. We were created to support all mobile networks around the world. We've got over 850 members from that particular ecosystem. But overall, we've actually got over nearly 1,300 members that are made up of the full ecosystem. So if you think about the mobile ecosystem, very similar to healthcare, we have the mobile operators, you have the hospitals, the doctors, and all of those guys. But then we've got all of the supporting infrastructure which aligns behind it. And we've also started to bridge into other sectors as well. So we've got Airbus as a member. we've got some of the auto manufacturers, and they actually helped us create and define the requirements for the embedded SIM, which is now you'll have multiple of those within your car, which they are leveraging and doing their business with. So our membership is huge. We've got global footprint. We think we've got 8 to 10 offices around the world in terms of the GSMA, and we're the trade association arm. But then we've also got MWC, which I'm sure your members would have heard of. I think it's probably going to be a big year in Barcelona. You know, last year was 110,000. We had over 200, was it over 2,500 exhibitors. So it's, you know, it is a huge scale. And again, that's where we try to bind and bring everybody together. So through the mutual itself, that's our role of bringing people together. And then through things like MWC, we try to make it even more tangible.
Well, I mean, this sums up for those of you watching as to why we, the Global Health Connector, wanted to partner with this, because it's clear that we all need to align and support each other. And as you know, our slogan is connecting the dots. I think in this case, it's quite clear there are many, many dots to connect. We haven't connected them all yet, just started. But I think this will be exciting for all of our members. And thanks very much, Richard. Look forward to seeing you in Barcelona in a couple of weeks. Thank you.
See you in Barcelona.